Hello everybody. This is chapter 24 review. This involves chlamydia and rickettsia organisms. These are kind of by themselves because they have characteristics of both bacteria and viruses. So there is one big family called Chlamydiaceae when we talk about chlamydia. This family has two genres. It has Chlamydiae and the genre Chlamydophila. These are gram-negative coccozoid or coccobacilli organisms. Generally speaking, that first genre, let's talk about that one first. Chlamydiae possess DNA and RNA. They have peptidoglycan in their cell walls, and they demonstrate susceptibility to bacterial agents like bacteria do. However, they are obligate intracellular parasites like a virus. They have a unique growth cycle. This genre has two distinct forms of the organism. It has an infectious form called a elementary body and a non-infectious form called a reticulate body. In the life cycle, there are 5 basic steps. The first one, the elementary body will infect the host cell by inducing phagocytosis. So once inside the cell, it prepares to replicate. So step 2, at 8 hours, they organize, the elementary bodies will organize into reticulate bodies. They will utilize the host cell synthesizing functions for their own needs and start to multiply by binary fission. That brings us to step 3 of the life cycle. At about 24 hours, they begin to reorganize back into the elementary body form, which is the infectious form. Step 4, at about 30 hours, multiplication will stop. And step 5, that occurs about 35 to 40 hours. The host cell will die, lyse, and release all of these new elementary bodies or infectious forms into the body. And this cycle will then start all over. So there's one particular organism in the first genus, Chlamydia, that we're going to discuss, and that is Chlamydia trachomatis. But before I go there, there's a couple more characteristics included in this genre. The first one is that this genre has an outer membrane that contains a large LPS or lipopolysaccharide, which is shared by most members of the family, this characteristic, and is the primary antigen detectable in genus-specific tests in serological assays. So when looking at this as a genus, we look at the LPS or detect something in the LPS or the LPS itself. The elementary body form has an outer membrane similar to that of many gram-negative organisms, the most prominent component of which is the major outer membrane protein, or MOMP. And this contains both species and subspecies specific components. So when we speciate an organism in this genre, we speciate it by its major outer membrane protein. Okay, so let's talk about the organism in this genre called Chlamydia trachomatis. So Chlamydia trachomatis is the most common sexually transmitted bacterial pathogen in the U.S. The rate of infection is in females 3 times more than that of males. Washington, D.C. has the highest rate of infection, and I believe West Virginia has the lowest. There are 4 infection types caused by Chlamydia trachomatis. The first one is urogenital. Infections in men include non-gonococcal urethritis, epididymitis, and prostatitis. Infections in women include urethritis, cervicitis. It can cause endometriosis. It can lead to pelvic inflammatory disease, perihepatitis, or Fitzhugh-Curtis syndrome. Also, it can cause salpingitis. And this is an infection that can result in infertility or ectopic pregnancies. This is a major cause, this organism is a major cause of sterility in the U.S. So Chlamydia trachomatis is a major cause of sterility. The second infection type is Chlamydia trachomatis infection in a newborn. And this is acquired through the birthing process in the birth canal. Infants suffering from chlamydial infection experience conjunctivitis or nasopharyngeal and pneumonia infections. So its portal of entry is ocular or aspiration. The third infection type is called trachoma, and this is a chronic conjunctivitis resulting in scarring and continual abrasion of the cornea. Left untreated results in blindness. The number one cause of preventable blindness in the world, trachoma, this organism is the number one cause of preventable blindness in the world. The organism is shed in feces, spread person to person or person to fomites, and then fomite to person, or flies to people. It is not commonly seen here in the U.S. It's more of an equatorial disease. And blindness prevention can include antibiotics and a surgical procedure of scraping on the under eyelid. And the fourth infection type caused by Chlamydia trachomatis is lymphogranuloma venereum, and that's LGV for short. It's caused by serotypes L1, 2, and 3, and that is classified by the major outer membrane protein. It's unusual in the U.S., but frequent in Africa and South America and Asia. You have this initial lesion. It goes away usually on its own, but bacteria can enter your lymph nodes, causing buboes and even lymph node rupture. So those are your 4 infection types with that genre. But when we look under the microscope, usually the direct exam is 95% sensitive looking under the microscope. However, it takes high quality skill on the tech part, and it's time consuming. There is a direct fluorescent antibody stain that can stain the elementary body, and these demonstrate this characteristic green apple fluorescence, but positives have to be verified by an alternate method. There is the cell culture. Now, that was previously considered our gold standard for diagnosis. However, it's not so anymore. It's only about 80% sensitive. Our gold standard today, or preferred diagnostic method, is a nucleic acid hybridization or DNA probe. There are enzyme immunoassay techniques which are common and they're common rapid antigen assay. And these are kit form, and they can detect either an MOMP or LPS antigen. So let's move on to our next genre, and this is Chlamydophila. Chlamydophila has 3 species that I'm going to talk about. The first one is Chlamydophila pneumoniae, and this is an important respiratory pathogen. causes acute respiratory disease, pharyngitis, and pneumonia. Let's see. Chlamydophila pneumoniae has been established as a risk factor for Guillain-Barré syndrome. Guillain-Barré syndrome is a condition where the immune system attacks your nerves. It's thought to be triggered by bacterial or viral infection. In this situation, it would be the bacteria Chlamydophila pneumoniae. And these damaged nerve cells cause ascending paralysis, which can be very severe. The clinical infection with Chlamydophila pneumoniae is the third most common cause of infection or infectious respiratory disease. 6 to 10% of the total annually, with an estimation of 200 to 300,000 cases annually. About 90% of those infections are asymptomatic or mild. And the highest risk group is 6 to 20 years of age. So you have 2 phases. It's a biphasic disease. The first phase, you have this prolonged sore throat and hoarseness. About a week later, you have flu-like lower respiratory tract symptoms, which can last anywhere from a week to 2 weeks. Then the second phase often results in pneumonia and bronchitis, occasionally sinusitis. So to diagnose this, you can use cell culture. You can use an indirect fluorescent antibody to the MOMP. You can use complement fixation with genus-specific antigens. You can also use a microimmunofluorescent technique, which is the present method of choice. It's more sensitive and specific than the complement fixation. The next organism I want to briefly talk about is Chlamydophila psittaci. And let's see. Chlamydophila psittaci is also known to cause something called parrot fever. Its technical term is psittacosis, or known as ornithosis, but parrot fever is its common name. It's not just parrots, but it can include other birds. And so it's zoonotic. You will develop fever, chills, headache, a dry cough. Pneumonia is often evident on a chest x-ray. Diagnosis is usually made based on history. Have you been around birds, or do you own a pet bird? And serology. Isolation of Chlamydophila psittaci in culture is very difficult. So usually it's a serological test and a history of the patient. And then the third organism in that genre, Chlamydophila, is Chlamydophila picorum, and this is not a pathogen. So it's not clinically significant, that organism. That's all I want to say about that. The next group in this chapter was Rickettsia. So these are short, non-motile, gram-negative bacilli. Most are arthropod-borne. They're obligate intracellular pathogens that grow only in cytoplasm of host cells. They're divided into 2 groups based on their type of clinical infection. The 2 groups that Rickettsia are divided into are 1, clinical infections called spotted fever. So this is the spotted fever group. And then the second group based on infection is the typhus group. So that first group causing spotted fever, or spotted fever group, is caused by 3 primary pathogens. The Rickettsia here in this type of group, or this spotted fever group, travel through the plasma membranes of host cells. They do not damage the host cell. Important note. So the first organism in this spotted fever group is Rickettsia rickettsii. This causes the most severe rickettsial infection, and this is called Rocky Mountain spotted fever. The vector is a tick, a 7-day incubation followed by flu-like symptoms. You have this distinctive rash on your wrists and ankles, possibly palms and soles. Dissemination can lead to vasculitis in the lungs, brain, and heart, with eventual related complications. Untreated mortality is 20% rate. We treat this though with tetracycline or chloramphenicol, and then that decreases our mortality rate to about 3 to 6%. So a pretty severe and clinically significant infection. We have two other organisms in this group of spotted fever group, and that's Rickettsia acari, and this causes rickettsial pox, and Rickettsia coronari, and this causes botanus fever, also known as the Mediterranean spotted fever. Let's talk about the second group based on clinical infection, and that's the typhus group. Let's see. Important note, these replicate in the cytoplasm of the host cell and cause cell lysis, releasing the Rickettsia. So in this group type, there is cell damage. Two important species are Rickettsia typhi, which causes endemic typhus, also known as Maurine typhus. And then the second species is Rickettsia prowazekii, and this causes epidemic typhus. It's louse-borne typhus, and also causes something called Brill-Zinsser disease. To diagnose Rickettsia, isolation should only be attempted in a biosafety level 3 lab, and typically serologic assays are the only laboratory tests performed. These are not usually cultured. And that is all I have to say about Rickettsia and our chlamydia. That's a wrap.